After studying this module, you will be able to know about skeletal system, how to determine whether the material is bone or not and the source of bone, about various types of bones in the human beings, about identification of few individual bones and determination of its site, that is whether left or right. To introduce you the topic, all the bones and joints of the body are part of the skeletal system. Bones are made of minerals, protein fibers and various cells. The skeleton is responsible for providing support and protection for the soft tissues that make up rest of the body. For movement of joints, the skeletal system provides attachment points for muscles. Bone marrow present in bones produces new blood cells. Bones are the warehouse for iron, calcium and energy in the form of fat. Human body is made up of 206 bones. These bones are arranged in two major divisions, that is axial skeleton and appendicular skeleton. During excavation, various bones or bone fragments might be found which needs to be identified and then used for identification of individual and determination of various factors such as sex, age, race, stature, all these. Before identification of bones, it is important to determine whether the material found at the site of excavation is actually a bone or not. If it is a bone, then it is important to determine whether it is a human or the animal bone. Now let us see how to determine whether it is a bone or not. The bones are recognized as part of the complete skeleton system. It is easy to recognize individual intact bones as compared to fragments which are encountered during excavation. There are various types of materials such as plastics, pieces of tree roots which can be confused with the bone. The complete burning of bones by fire is rarely possible, but these bones will be broken and deformed. Due to exposure to fire and heat, the color and texture of the bones will change, and these changes will make visual identification difficult. To determine whether the material found is bone, someone with experience in bone identification is required. That means a forensic anthropologist who is well trained. The identification of material found as bone is very important to carry out further analysis, because once it is settled that if it is not bone, then further examination is futile. Now once we have certified or examined that yes, it is a bone, then the next question comes whether it belongs to a human being or animal. That is the determination of source of a bone. Again, similar to the case of determination of the bone, it is easier to recognize a bone, whether it is a human or animal, in a normal anatomical configuration. Identification becomes much easier if soft tissue or hair is present on the bones. Identification of human skull is easier as it is a rounded vault and round face, which helps to distinguish it from the animal skulls. Sometimes the fragments of cranial vault can be confused with the turtle shell. There are various features from the cross section and the surfaces which help in easy identification of human skull. In case dental fillings or caps are found, then it proves as sure sign of human teeth. Even in case of animals which are human pets, filling a dog's tooth is a rarest thing to be witnessed. Other bones such as long bones, small bones, pelvic bones, etc., all they have got their own identification characteristics. These bones have some similarities between the human and the animals which make them difficult to be recognized. The bear's paw bones can be confused with the human hands. The vertebra of the humans and deer is similar. Confusion can be created in case of bones of young children or infants. Bones of newborn child are even more difficult to recognize as they do not look like adult bones. Sometimes they can be confused with animals or birds. The growth center, that is the epiphyses, they separate the end of long bones from their shafts. And these growth centers fuse to the shaft at different times during development, but because of the non-united epiphyses, there will appear to be an excessive number of bones in children's skeletons. Experience is required to effectively distinguish between bones. Training, experience and time is required by a forensic anthropologist to successfully determine the difference between a human and animal bones. Now let's see the various types of bones. All the 206 bones can be divided into 5 types, that is the long bones, the short bones, the flat bones, the irregular bones and the sesamoid bones. Now let's see the long bones. These are larger in length as compared to its width. They form the main bones of the limbs. Growth of these is more as compared to other bones throughout the childhood and are mainly responsible for bulk of an individual's height as adults. Bone marrow is stored in these bones in a hollow medullary cavity which is originated in the center of these bones. The long bones include femur, tibia, fibula, clavicle, humerus, radius, ulna, metacarpals, metatarsals and phalanges. The short bones. These bones are almost equal in length and width and are often cubed or cuboid or rounded in shape. Short bones include carpal bones of the wrist and tarsal bones of foot. Now flat bones. These bones differ significantly in dimensions. These bones have a collective feature of existence that is very thin on one side. These bones do not have medullary cavity. And these bones include frontal, parietal and occipital bones of cranium as well as ribs and hip bones. Now the irregular bones. These bones have different structure as compared to long, short or flat bones. These irregular bones include vertebrae, sacrum, coccyx, sphenoid, ethmoid and zygomatic bones. Now then let's see the sesamoid bones. These bones are made subsequently confined inside the tendons that track transversely through the joints. These bones are responsible for protecting the tendons from pressures and tendons at the joint and giving a mechanical advantage to muscles pulling on the tendon. Sesamoid bones include only 2 bones out of 206 bones, that is the pisiform in the wrist and patella at the knee. Some of these bones can be formed in the joints of hands or feet and are not usually present in all pupil. Now let's see the identification of few individual bones and how their site can be determined. The femur, that is the longest bone of a skeleton, that is the thigh bone. The crown of femur fits in the acetabulum of the hip bone. Unlike the humerus and the glenoid cavity joint, it has a direct ligament attached between femoral bone and acetabulum, but that is by the ligamentum teres, which fits it snugly from the fovea capitis depression on the femoral head into the hip joint, helping to stabilize the joint. The greater and lesser trochanter is the main feature on the femur, present in the proximal half of femur and just below the femoral neck. They act as muscle attachment sites for gluteal muscles. Sometimes third trochanter is present distally to the lesser trochanter. The main attachment point of variety of muscles is the linea aspera, which runs directly posterior down the length of shaft of femur. This linea aspera collects the spiral, pectineal and gluteal lines at the end of femur proximally. The lateral and medial condyles mark the distal articular surface with the tibia bone of the lower limb. The lateral and medial condyles are the distal articular surface with tibia bone of leg. Just above the medial condyle lies adductor tubercle. The femur can be easily sighted as the trochanters are medial and posteriorly positioned, with the linea aspera running directly posteriorly and the adductor tubercle located medially on the medial epicondyle. The middle portion of femur is tear shaped. The round body of the tear is present anteriorly and top of it is present posteriorly. The anatomical landmarks of the femur can be understood by the accompanying diagram. Now let's see the tibia. It is a differently shaped bone. It has proximal, medial and lateral condyles, medial and laterally intracondylar eminence which is present at the posterior side, anterior proximal tibial tuberosity and curved tri-blade of the body. It is larger, medial and weight-bearing bone of the leg. It articulates at its proximal end with the femur and fibula and its distal end with the fibula and the talus bone of the ankle. The proximal termination is expanded into a lateral condyle and a medial condyle. The inferior surface of the lateral condyle articulates with the crown of fibula. The medial superficial side of the distal finish of the tibia forms the medial malleolus. To determine the side of the tibia, malleolus is observed. It is located on the medial distal aspect of the tibia. The tibial tuberosity represents the anterior facing proximal end of the bone, and the main anatomical landmarks of the tibia and fibula can be understood with the attached diagram. Now the fibula. The fibula is a thin bone. It is turpentine than other two bones of the legs. The crown of the fibula is located superiorly and can be easily complicated with the distal malleolar articular surface. The body of the fibula without the proximal or distal segment is almost impossible to recognize due to its irregularity. To determine the side of the bone, posterior facing malleolar fossa is found, which is located on the distal articular surface of the fibula. It can be successfully used in forensics or the archaeology when skeletal remains are limited. It can be also used as a marker of sex. Then let's see the long bones of the upper extremity, that is the humerus, that is the arm bone. It is the elongated and chief bone of the superior extremity. The greater tubercle is a lateral projection distal to the anatomical neck. The lesser tubercle is present anteriorly. Located on the lateral side of the proximal humerus is an expanded bony area called the greater tubercle. The smaller lesser tubercle of the humerus is found on the anterior aspect of the bone. Passing between the greater and lesser tubercles is the narrow intertubercular groove, that or sulcus, which laterally at the middle portion of the shaft there is a roughened V-shaped area called as the deltoid process. The capitulum is present, which has a rounded knob on the lateral aspect of the bone that articulates with the head of the radius. Radial fossa is an anterior depression above the capitulum that articulates with the head of the radius when the forearm is bent, and it is also known as bicipital groove. Let's see the bones of the forearm. The ulna. Ulna is located on the medial aspect of the forearm and is longer than the radius. The proximal end of the ulna resembles a crescent wrench with its large C-shaped trochlear notch. The inferior margin of the trochlear notch is formed by a prominent lip of the bone called as the coronoid process of the ulna. And just below this, on the anterior aspect of ulna, is a roughened area called as the ulnar tuberosity. To the lateral side and slightly inferior to the trochlear notch is a small smooth area called the radial notch of the ulna. At the proximal end, olecranon is present, which forms the prominence of the elbow. Again, the attachment, the arrangement of the ulna and radius can be understood by this diagram. Now the other bone of the forearm, that is the radius, the lateral bone. The radius is the smaller bone of the forearm and runs parallel to the ulna on the lateral side of the forearm, that is the thumb side. In contrast to ulna, the radius is narrow at its proximal end and widens at its distal end. The head of the radius is a disc-shaped structure that forms the proximal end. The neck of the radius is the narrowed region immediately below the expanded head. Inferior to this point on the medial side is the radial tuberosity, an oval-shaped brawny protuberance that serves as a muscle attachment point. The shaft of the radius is slightly curved and has a small ridge along its medial side. On the medial side of the distal radius, ulnar notch of the radius is present. The side finish of the radius has a sharp projection known as the styloid process of the radius. To summarize this topic, the bones consist of the minerals, protein fibers and various cells. Bones are the warehouse for iron, calcium and energy in the form of fat. Before identification of bones, it is important to understand, to confirm whether the material found at the site of excavation is actually a bone or not. Once it is determined that if it is a bone, then the next question is to determine whether it's a human or animal bone. The humans have total 206 bones, which are divided into 5 types, that is extended, small, even, uneven and sesamoid bones. The longest bone of the skeleton is the femur, that is thigh bone. Greater and lesser trochanter is the main feature on the femur, present in the proximal half of femur and just below the femoral neck. Tibia has proximal, medial and lateral condyles. The medial and laterally intercondylar eminence, which is present at the posterior side, anterior proximal tuberosity and a curved tri-blade of the body, also called as shin bone of the body. The crown of the fibula is located superiorly and can be easily confused with the distal malleolar articular surface. Humerus is the extended and major bone of the upper limb. The capitulum of the humerus has round handle on the adjacent side of the bone that articulates with the crown of radius. The ulna is situated on the medial side of the forearm and is extended or longer than the radius. The proximal termination of the ulna looks like a hemispherical wrench with its great C-shaped trochlear notch. The radius is the smallest bone of the forearm and goes corresponding to the ulna on the lateral or the thumb side of the forearm. In contrast to ulna, the radius is narrow at its proximal termination and widens at its distal end.